Marty, thanks for joining us on HCM Awareness Day. I know you're out of the country working hard for all of the community worldwide. So welcome and happy HCM Awareness Day.
Yes, thank you. Thank you. Happy HCM Awareness Day here on Valentine's Day. Sorry, we are not, well, at least we're recording it on Valentine's Day. I'm not live, as you just said. I'm overseas at an HCM meeting trying to advance the understanding, of course, of the disease globally here, which, as you said, I think is an important priority. But sorry, I can't be with you live.
No problem. Okay, let's get you centered on the screen so you look great for everybody watching. So we're going to talk about top things HCM patients need to know
Okay.
and what we've learned recently that might change understanding if it applies to the area.
Okay.
Imaging in HCM, critical factor. How often do patients need to have imaging and what kind of imaging should they be looking at annually?
Yeah. Well, imaging is so critical, as you just said. It's almost a core element of the evaluation of patients with HCM, not just initially, but obviously longitudinally too. And that usually means on a yearly basis. We'll talk. So initially, it should be probably a combination of both echocardiography and cardiac MRI, if that's applicable for that patient. But most patients can have MRIs and should, because both the MRI and the echo provide kind of what we call complementary information about the patient's HCM heart, so in terms of wall thickness, function, and also the inside the muscle, the fibrosis and scarring, which is something that only MRI can do. And so there's strengths and limitations. There's strengths of each of the modalities, the echo and MRI, but we're trying to, gather the strength of each of those to apply to a patient initially, and then for follow-up. Really, it should be for almost all patients, particularly young, middle-aged. It's yearly echocardiography, because we're of course trying to continue to follow if there are any changes to the HCM heart, and if so, we want to be on that early so that we can redirect therapy if we need to.
And when do you bring in a stress echocardiogram to the evaluation?
Yeah, great question. So stress echocardiography, or what we also call exercise echocardiography, is typically done certainly as part of the initial evaluation at an HCM center if a patient does not have obstruction to a certain degree at rest, or under the basal conditions with the rest echo. So in other words, if there's no gradient at rest, we then do the exercise for sure to see if there is an exercise-induced outflow gradient, because if there is, that's super important to know, as we'll probably talk about in a minute, because it can impact how we treat patients and, of course, what patients can expect for the future as well.